Difficulties with movement and mobility are a problem for many people and can have a significant impact on quality of life. Thankfully, physical therapy can often greatly improve a person's ability to function and complete tasks independently. For Sam, familial dysautonomia makes mobility and independence particularly challenging. She began working with a physical therapist when she was just 18 months old, and now, at age 30, she still has the same therapist.
No, I'm okay. Okay.
Sorry about that.
It was really nice seeing you.
You too.
I'm gonna call you. Hello.
I will.
Hello. Long time no see.
I know. How you doing?
I'm good. I'm good.
That's good.
So you guys are leaving?
Yeah, we're heading out.
Okay.
Cash and I.
Yeah. So
All
we'll
right.
give you some fluid, and I'm gonna check your blood pressure.
Okay.
So this way we don't pass down the elevator. Okay. So
I'm hungry.
yeah, you'll have food afterwards.
I will.
Okay. My name is Ling. I'm a physical therapist and a faculty member at Steinhardt School at New York University. I also chair the Department of Physical Therapy. Only in the last 20 years, physical therapists started treating patients with familial dysautonomia. Because before that, before the FD Center set up at NYU Langone, it's a area that's very often left undiagnosed. So children may have a problem, but they were not diagnosed properly. They were not cared for properly. So now I think finally we identify children early on when they are diagnosed with FD, they're referred for physical therapy services. We can keep them up moving for a very long time. When they're up moving, they usually have less complications to their heart, less complications to their lung, because that's usually the big problem. They have getting up, standing, walking is also better for the digestive system. So they're not, when your digestive system works properly, they'll eat better, they will have better nutrition, they have better probably immunity because they have better nutrition, they can resist disease or infection better. So in general, keep them up moving is good. You can, do you know what? You can have it. I just don't want you to have it because that will not now, because that will change your blood pressure.
Oh,
so when you're done, you can have food. Because you had pizza today. How many slices did you have?
4. But it wasn't that good.
Gee.
It was okay.
It was not good and you ate 4?
I was hungry. It was lunchtime.
Oi, Samantha. Did you eat anything on Saturday and Sunday? Because usually you eat something on weekends.
Nope.
So you save it for today?
Yeah.
Okay. So this is what I think we'll do. We'll do exercise. Remember, you bring your legs up. We'll do that because that works on your tummy muscle. And then we'll do sit to stand. Okay, 'cause that works on your posture. Okay. Then we're going to go over to the window sill. Okay. So we'll work on squatting, standing on toes, standing on heels, and then ballet. Okay. How does that sound?
Good.
Okay. So we'll rest a little bit. I'm not pushing you. Okay. So before we do our bring the legs up, I want you to work on your neck, okay? Because we have to really we all need to work on neck muscle. Do you know why? Because all of us are addicted to our phone.
Yeah.
So we're like this the whole time. So we have to work on our posture, okay? I actually started seeing Samantha when she was 18 months old. So I started seeing her when she was a baby. She was not able to sit independently. She was not able to crawl. She was not able to stand independently. She was not able to walk. So I have the fortune to see her over a 22-year period. So I see her as an infant all the way through adulthood. So I see the changes in her. And she really is exemplary in the way she worked with therapists. Because sometimes when a client has chronic disability or chronic problem, they go through phases of working with therapists, but she has always been supportive of her classmates. She's always having a friend circle, and they're part of it. That's why you saw me saying hello to Amanda and Kashi. So she always brings her friends to therapy sessions too. So that's really unique. Very often it's isolation. You know, a therapist works with a child in isolation. Nobody in the family gets involved. Nobody in the social circle gets involved. Okay. Tuck your chin. Look at the ceiling. Tuck your chin. Look at the ceiling. Now side, bend to the side. Good. And then make your ear closer to your shoulder. Good. Now tilt to the left. Tilt to your right. Excellent. Now we're going to turn your chin chin. Turn. And the other way. Turn. Turn to your left. Turn to your right. Now we're going to add the arms, okay? Okay. Tuck your chin. Lift your arms and look at the ceiling. Blow, blow, blow. Excellent. Tuck your chin. Now lift your arms and look at the ceiling. Blow, blow, blow. Lift your legs. Put your hands on here. Sit up straight. Don't lean back, okay? Bring your legs up. 1, 2, 3. Good. Now lift your legs up. 1, 2, 4, 5, 6, 8, 9, 10. 2 more. 1, 2, 4, 5, 6, 8, 9, 10. Good. Last 1, 2, 4, 5, 6, 8, 9, 10. We're gonna stand up straight, okay? Come. Up. Hands over here. Stand up tall. And squeeze your butt so we're really, really tall. Good. 1, 2, 3. Now lean forward. Sit down nice and slow. Beautiful. That was good. Stand up tall.
I've done a lot of sit-to-stands today and terrorism.
Really? Really?
Mm-hmm.
How come? Just pull. Your blood pressure was high? Oh, okay. So now let's check your blood pressure. If you're good, then we're going over to the windowsill. Let's take a quick break. When Samantha was young, our goal at the time is really to get her walk independently. Because she was smaller, her size was smaller, she's shorter and her weight is less. So the physical burden or physical work that she needed to do to walk around was less. So that's what we work on. So our goal start changing when she now becomes, adult size. She's taller, she's heavier. The physical work she had to do to walk around is more. So the goal is really to be mobile. So she's in a wheelchair. As long as she can negotiate an environment in a wheelchair, that's fine. Yeah. So we don't emphasize walking as much. I still get her up and walk because that's good for her posture. It's good for her digestive system. It's good for her pulmonary system. Right. We still get her walk, but it's no longer a primary focus. So I think there's a shift when children start grow and when they reach adulthood. I say to her, I wanted to get out of the house every day. I wanted to go to work. I wanted to engage with other people in the community rather than to waste a lot of energy to do walking. So walking is just a very small component of her daily activities rather than one of the most important tasks that I ask her to do.
182, 150 over 75.
That's good, that's good, that's good. Let's go for a walk. Yeah, this is good. Take that off, turn it off. Okay. Now remember, don't scoot. You have to stand up tall, okay? Both hands on the armrests. Stand up tall and then turn around, reach over. I don't want to twist. What?
The climb from the Hannah Montana movie.
This was the same last week.
Well, because I've been singing it every day.
Uh-huh. What you did with Frozen. You brainwashed me.
I like Frozen.
I know, so you brainwashed me.
The animation's amazing in that movie.
I know.
Last time it's like sardines in an elevator.
Yeah, wait, if they are off, then I can press. I want to have you on the video. This I said, blood pressure 60 over 36. Samantha, why did you stop talking to me?
When I have an obsession now,
What?
I'm mood ring.
Oy vey.
It was
You
out of your
keep-
style.
Yeah.
You keep the U.S. economy. Okay.
But if I get another one,
You know, today is Amazon Prime Day. We can go shopping.
if I get another one, it takes a great
Yeah. Hi. Hi.
Hi.
Okay, we're gonna go check to see our friend Carol. Because I think that these shopping specials, special deals,
You can go inside and shop. It's a perfect day for weather like this.
if the weather's like this again tomorrow, then you shouldn't go outside. Yeah, you shouldn't go outside. This whole week is gonna be bad. There are situations that we can do exercise in a clinic. You do 5 times weights. But it's really doesn't always translate to a client's daily activities, their functional activities in the environment. So I try to give Samantha exercises that translate into her function. So if we work on standing, she can do that in front of the sink. She can do that when she pick up mail. She can do that when she signs a paper in the package room. When we do walking, she can negotiate walking independently to the elevator or walking to the mailbox. Or when she's doing better, we can actually walk to the supermarket. We can actually stand up in front of the shelf to pick things off the shelf in the supermarket. I don't want her to do exercise in isolation. In a clinic, in her apartment, I want her to be a member of the community. So that's why we do exercise outside the apartment. We go down to the mail room, we talk to neighbor, we talk to doorman, we talk to the mail, the package room clerk, because that's important for her.
Thanks, girl.
Thank you, Carol. See you tomorrow.
All right.
This is Carol, our best friend. Okay. Very good. I know, I just realized, when we go back up, I'll try not to trip on my face. This would be embarrassing. Your physical therapist is a klutz. You're doing marvelous. Really good. This is very good. We're gonna walk back to the apartment, and then we're going to take a little break, okay? You're doing very well. It's nice to get out of the apartment, say hello to our neighbors, meet your best friend Carol in the package room. Very often we think walking is walking, but when she's walking, her heart is pumping, her blood pressure is high, blood goes to her brain. You can tell she's perkier, and she's using her social skills, she's using her brain, she's using her cognitive skill also better. So absolutely, things are sort of all connected. It's not just about the physical capability, it's a physical capability, psychological state, also mental capability. Where?
On 77th Street.
So by where she lives then?
Yep.
Did she have trouble with electricity on Saturday?
I don't know.
Because you know there was a blackout, right? Here we go,
yeah.
gonna go back
What
on
about
that
the mail?
chair. I will pick them up later. Okay, go sit. I want you to sit. Okay, reach over, no, this chair. Reach over, no plopping. Reach over, both hands, nice and slow, good. Very good. I'm gonna rest a little bit. How do you feel?
Okay, just long day.
Yeah, I know. Okay, well, rest a little bit and I'll check your blood pressure. I think it's still okay. How's your eyes? They're not blurry, right? Okay. Okay, so now we're gonna work on standing on toes, okay? 20 times. 1, 2, 3, 4. Slow down. 5, 6, 7, 8, 9. Slow down. 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. We're gonna stand on our heels, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Excellent. All right. Stand up tall. Okay. 1, 2.
That's fine.
I know, someone just messaged you. 3, 10, 11, 12. Make the top arm reach. 13, 14. Excellent. 15, 16. So now we're going to work on your hip, okay? Push back. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Marvelous. Okay, turn around, honey. Try to stand up tall and don't lean on me, okay? I got you.
A little wobbly.
I know. Push back. 1, 2, 3, 4, 5, 6, 7, 8, 9. Sideways. 1, 2, 3. Excellent job. Excellent. Now turn around, lean on the windowsill. Let me get your walker. Okay. Okay. 1, 2. 1, 2. Now we're going to lift our arms and try to touch the painting. Lift. 1, 2. Lift. 5. 1, 2, 3. 3. 1, 2, 3. 4. 1, 2, 3. Good. Actually, like it. 5. 1, 2, 3. Excellent job. We're done. I remember one story I have to tell you. So when she was little, I think she was 5 or 6, we went outside because we ride tricycles outside. And she had to say hello to everyone. And we met a child with a parent on the street. So Samantha knows the child, Samantha knows the parent. So she has introduced me. So this was the most heartwarming moment that I can remember interacting with Samantha. So she said, hello, blah, blah, blah. So I said, well, introduce me. So she said, hi. This is when she comes and she plays with me. She never said, I'm her therapist, I do exercise with her, but that's really the philosophy, right? You don't want the child to feel like this is really a very sterile thing. It's happy, it's getting her involved. She feels that when I'm here, I'm playing with her, and it's part of her life. She goes out, she gets involved with the community, and that's really wonderful.